Good afternoon, everyone. Alan Harris, Emergency Manager for Seminole County. Thank you all for attending the press conference this afternoon. I'm going to give you an operational update for Seminole County's response to COVID-19. We currently have 219 cases of COVID-19 since the onset of the emergency reported in our county. 213 of those are residents, and 6 of those are non-residents, individuals that have traveled to the area. They may have been with family during the onset of their case. Good news, 82 of those individuals have completed their isolation and quarantine time. So that means that they are now allowed to go back into the public. They don't have to isolate and quarantine in their house. They have no signs and symptoms for a lengthy period of time. So they're back doing their normal daily activities, as normal as you can be during this time period, which means that 137 individuals are actually isolated and quarantined in their house with COVID-19 here in the county. As far as hospitals go, we currently have 14 individuals inside of the hospitals with COVID-19, and 29 of those individuals are persons under investigation. So those are individuals that have signs and symptoms, and they are being tested for COVID-19. We had a conversation yesterday with our hospital systems, and all of the hospital systems have surge capacity currently in the county, and we are all planning for a potential surge in the Central Florida area, working with all of our surrounding counties. In the ICU area of the hospitals, there are currently 3 individuals in Seminole County in ICU beds, so quite a bit of capacity still left in our ICU beds here in the county. And want to thank Advent Health, Orlando Health, and HCA, wonderful hospital systems. We're really truly blessed to have those folks here in Seminole County that are working very, very closely with us to provide those numbers and also to help us in helping them with the planning. So as a part of that, we have been giving out lots of different personal protective equipment to the hospital systems, as well as to assisted living facilities and nursing homes, to make sure that our healthcare workers are protected during this event. So to date, we have received and sent out over 50,000 masks, over 11,000 gowns, and over 55,000 gloves to our assisted living facilities, nursing homes, and hospital systems. Testing is going much better, of course, than the onset. So we have 21 facilities currently testing here in Seminole County. To date, we've tested 2,436 individuals, and of those, 216 have come back positive. So approximately 9 to 10%, which is the state average as well, are coming back positive. Up in the Emergency Operations Center, we are continuing to phone individuals on a regular basis to make sure that they are okay, that they don't have any needed additional services, things like that. And of those individuals that are isolated and quarantined in their homes, they have been provided certain types of commodities, food products, as well as pharmaceuticals, again, so they don't have to leave their house. And to date, we have delivered over 179 boxes of food. So a box of food will to feed a family for about a week or a week and a half. So 179 boxes of food have gone out to families that were unable to get food either through delivery services or through family and friends to deliver food. So we've been working with nonprofit organizations to get those foods to those individuals. I want to just enforce our telephone number and our website. PrepareSeminole.org as our website has a lot of great information about Seminole County and our response. So please go to that website for information. And then we have staffed our Citizens Hotline 7 days a week now to help you get the proper information. 407-665-0000. Again, 407-665-0000 from 8 a.m. to 5 p.m. 7 days a week. And with that, I'd like to turn it over to Chairman Zembower for information on Seminole County.
Thank you, Alan, and thanks everybody for tuning in today on behalf of the Board of County Commissioners here in Seminole County and our 7 cities. We appreciate you staying up to date and tuning in not only to these press conferences, but to our emergency managements, Facebook Lives, and paying attention to what information is being disseminated. Just a quick update before we move into today's business topic. Yesterday, I want to thank Mayor Demings in Orange County, who facilitated a regional teleconference between multiple cities and counties throughout the region. And I want to assure our public that we are working with Mayor Demings. We are also working with the folks in Osceola County and Chairperson Campione up in Lake County on having a regional discussion on if the event happens that we have a need for surge capacity in our hospitals, that's taking place. Later today, we will be drafting a letter to the governor from each respective county, as well as a group, to let the governor know that we have collaborated together. We have some plans in place. Those that are materialized, we're also going to be putting together a task force on how things look once the time arrives. It's time to get back to work. A lot of people are suffering in the community. Of course, everybody knows, and we see the headlines every day of the amount of layoffs, the jobs that people have lost. The small businesses are really taking an impact. We have elderly people that are at home alone. What I will say is, right now, the trend lines and numbers are looking good, and we thank, and that has to be credited to the public in listening and obeying by the social distancing guidelines. We're certainly not out of the woods yet, but this is a time to keep your eye on the ball. I think everybody's doing a great job, and we're thrilled of the amount of participation we're getting in the social distancing. Again, if you're going out to get supplies, we also suggest that you designate one person in the household to go out and get those supplies instead of taking the entire family or 3 or 4 individuals. I know it's hard to stay in the house, but there are parks and trails that still remain open in the county region. We would urge you to get out, get some fresh air, keep your social distancing. If you're going to do it in a family unit, that's fine, but do everything you can to keep your social distancing. As we are here today to talk about what the impacts are on our small business community, everybody's hearing the difficulties in getting a hold of some of the bridge loans, some of the SBA items. So I want to share a little bit with you of what's going on here in Seminole County. First, we would encourage you to go to the Florida Department of Economic Opportunity, which has created a damage assessment website. And this is in order to clarify and understand what the impacts are so they can determine what kind of funds may eventually come to a given area. So that website is floridadisaster.biz, floridadisaster.biz. We encourage you as business people, go to that website, take the survey, share that information with the Department of Economic Opportunity so that the proper funding can be considered to come to our business owners. Also, so far in Seminole County, we've had 260 businesses that have completed the survey, and that impact is over $53 million in estimated losses, 1,362 temporary layoffs, and 175 permanent layoffs. Now, we know that number is much larger because we know that not everybody has gone to the website at floridadisaster.biz and taking that survey. We urge you again, go to that website, floridadisaster.biz, fill out that information so you can be counted. Most businesses that have done the survey have noted the following: lack of customer base, short-term capital issues, and a lack of product supply as hindrances. Emergency bridge loans continue to be a struggle to get banks affiliated with the program, connected with the business owners. So we urge you to continue to work with your banks. Also reach out to SBA. Now today, we also want to make sure everybody knows with the reemployment applications that you've been having trouble online. The governor's office is restaffing and adding staff for that purpose, as well as rebuilding and overhauling the website to allow more interaction for people to get in. With that said, we are making paper applications available. They'll be outside the county services building, the community services office, and most of the city halls throughout Seminole County. So if you're having trouble getting online, which a lot of people are, and you can't get through, social distancing, you can go out and pick up a paper application at one of the city halls or the the Community Services Building or the County Services Building here in Seminole County. You will find those in paper format, of course. They'll be in a cardboard box outside the front door as you come in. Again, get what you need. If your neighbor needs one, or 3 or 4 in the family need one, send one person to get it, get what you need, and then get that filled out and sent in. Today we also have Gaby Ortigoni from Hispanic Chamber with us today, and Amy Kirkland from Seminole State Small Business Development Center to discuss ways our businesses can find information and assistance. We also have Chris Anderson, our Supervisor of Elections, here today. It's also going to talk a little bit about what's going on with voting throughout the community. Thank you all again. We appreciate it.
Good afternoon. I'm Amy Kirkland with Seminole State College Center for Business Development. And Seminole State College's Center for Business Development has been assisting small businesses in Seminole County for over 24 years. Through our Small Business Development Center, Business Incubation Program, our Advisory Board Council, and Corporate College programs, we support businesses of all sizes and in various stages of development, from startups to multi-million-dollar companies. Throughout the year, we provide confidential, no-cost, one-on-one consulting, educational seminars, advisory boards, research, analytics, and more. We serve as the county's hub for all things small business related. And now, at this most critical time, we're committed to allocating all of our resources to helping our business community get through this catastrophic event. Our SBDC, a subcenter of the UCF SBDC, is part of the Florida SBDC network, which is state designated as Florida's principal provider of business assistance. In partnership with the Florida Department of Economic Opportunity, we are assisting business owners with the Florida Emergency Bridge Loan application process. Our team has worked tirelessly to guide businesses as they apply for the loans, and we're directly involved in reviewing loan packages prior to being sent to the approval committee. Our office is currently offering all of our services virtually to comply with social distancing protocols. For more information or to apply for the Florida Emergency Bridge Loan, you go to floridadisaster.biz. That's floridadisaster.biz. Our team is also providing support to businesses who apply for the SBA Economic Injury Disaster Loan, also known as EIDL. Since the passage of the CARES Act, the Economic Injury Grant was added to the EIDL application process. These grants provide an emergency advance of up to $10,000 to small businesses and private nonprofits who are affected by the COVID-19 pandemic. To access the advance, business owners must first apply for the EIDL and then request the advance. The advance does not need to be repaid and may be used to keep employees on payroll, to pay for sick leave, meet increased production costs due to supply chain disruptions, pay business obligations including debts, rent, and mortgage payments. To apply, go to sba.gov disaster. The Paycheck Protection Program, the PPP, is part of the CARES Act. This program will provide cash flow assistance through federal loans to employers who maintain their payroll during this emergency. If employers maintain their payroll, the loans can be forgiven. To apply for this program, we recommend that you contact your business banker as they are processing this program. Due to the unprecedented nature of the pandemic, the demand for all of these loans has been overwhelming, and the process has been extremely fluid. Our team is working diligently to stay on top of the latest announcements so we can provide the most current information to business owners. Currently, both the state and federal loans are available, but due to the magnitude and the impact of COVID-19, the funding will eventually run out. Our recommendation is that you act, and you act quickly if you intend to apply. To stay connected and for updated information, you can follow us on Facebook at Center for Business Development at Seminole State College, or for more information about our center and the services that we provide, go to seminolestate.edu/CBD. And thank you, Seminole County and the Board of County Commissioners, for supporting the Center for Business Development at Seminole State College, which allows us to serve the business community. Thank you.
Good afternoon. My name is Gaby Ortigoni. I'm the president of the Hispanic Chamber of Commerce of Metro Orlando. Thank you so much to Seminole County, to the Board of County Commissioners, and of course Chairman Zembower for inviting us to be part of this important session as we educate our community about the things that are available to help during this pandemic. The Hispanic Chamber of Commerce of Metro Orlando is conducting a series of seminars in both English and Spanish to educate not only our members, but the entire business community, particularly the Hispanic community, in different topics. Right now we know how important it is for the emergency loans, the CARE Act, and because of the speed of the situation and how quickly everything is happening, we understand that a lot of agencies are not able to translate this information as quickly as possible, as quickly as they would like, into Spanish. So right now we are providing the tools and the education avenue so we can provide this information to our Hispanic community in both languages, so they can have Spanish-speaking residents and members of our chamber can have the information directly and precisely when they need it. So for more information about the different webinars that we have been conducting, you can visit hccmo.org. hccmo.org. That's our website, and you'll be able to find information not only on the webinars explaining the different programs, but also on other essential tools that your businesses need right now as you are adapting your business into maybe a virtual platform. We are also serving as a platform or as a source for information also with Spanish-speaking media for Central Florida. So we're very honored to have this opportunity today and to also convey any information that the county would like to share with our Spanish-speaking media as well. We are also connecting Hispanic small business with agencies such as the SBDC, SBA, and we're working in partnership with our sister organization, Prospera, to ensure that our Hispanic community has access again to the application process, understanding how to fill out these forms, who to contact. We have been dealing with many, even small business owners who probably their banks right now, they are not being able to process their loans for many different reasons, and right now we're looking for other avenues that could also help them and assist them, and in particularly when it comes to a very frustrating situation, and if they need the assistance in Spanish, we're able to provide that, as I mentioned, in partnership with our sister organization, Prospera. And lastly, in a few weeks, we will be launching a special program that is going to create an e-commerce platform for not only for our members, but we're going to offer this to this entire community in different levels in which people who have not, businesses that were not ready to be able to participate or to activate their businesses online will be able to provide this platform that they'll be able to promote the products that they're selling, but also the products that they're buying, so we can also create more activity utilizing technology that right now we're investing in that technology, utilizing those tools, so now we can also create more economic, hopefully more economic activity as we go through this situation and during the next steps as we rebuild and we bring our economy back, so hopefully very soon. So once again, thank you so much for giving us the opportunity to be here. It's an honor to serve also and be part of this incredible county that has done so much for the community, and now I'm honored to present Chris Anderson, Seminole County Supervisor of Elections.
Good afternoon. I'd like to thank first our first responders and our medical professionals for their work and dedication during this most difficult time. I'd like to thank the Office of Emergency Management, Director Harris, and Chairman Zembower for their hard work and dedication. I understand that there's some concerns about the general election, and of course we have the primary election coming up next, which includes in-person voting. My office is taking a proactive approach to this. We will be sending out a vote-by-mail request. This vote-by-mail request will be in your mailboxes, hopefully at the beginning of next week. It will have your voter information card on it, and that is yours to keep, and attached to it will be a vote-by-mail request. All 320,000 voters in Seminole County will receive that, and that is at no additional cost. The way that you go about requesting vote by mail, because we believe that that is the safest way to vote, we started an initiative called Stay at Home, Vote at Home. That is a hashtag that we encourage everyone to use. To stay up to date with your elections office, you can follow us on Facebook, Instagram, and we have an active Twitter feed on our webpage at voteseminole.org. To request a vote by mail ballot, you can call our office at 407-585-VOTE. That's 407-585-8683. You can go online at voteseminole.org and do it from the comfort of your own home. You can also go online and print out the form and send it to our office. Now, the reason why you would do that is because you would want the ballot sent to an address that we do not currently have on file. We would need written authorization to do that. Next, I'd like to talk about some concerns that, and lastly, my last point with vote by mail before I move on is tracking your vote by mail ballot. There are concerns about putting it in the mail. You can always drop it off at an early voting location, 7 locations, which are our county libraries. But you can track your mail ballot 24 hours a day, 7 days a week at our official trackmymailballot.org. Now, there are some concerns from a lot of the candidates in regards to qualifying. The Secretary of State here in the state of Florida signed 2 emergency rules that relax some of the current rules in place. The first one is Emergency Rule 1, SER 20-1. This provides qualifying documents to be submitted via email, and they're going to update the forms where a notary is required, and that will be able to be done via a conference platform such as Zoom or Go Meeting. The second emergency rule was SR 202, which is candidate petition process. This essentially allows candidates to collect petition signatures. They can have a voter fill out the form in the comfort of their own home. They would have to sign it with their original signature, and they could take a photo of it, or they could scan it in or fax it to the candidate, who in turn would have to print out that image and turn it into the Supervisor of Elections office. The election dates are for the primary election is August 18th. Early voting will be August 8th to August 14th. The hours of operation will be 10 a.m. to 6 p.m. Election day for the general election is November 3rd. Early voting will start October 19th to November 1st. And I just want everyone to know that our in-person voting, our sanitation practices within our precincts will continue with our hand sanitizers, our wipes, making sure that we have extra stylists, staggering our voting booths where voters aren't standing next to each other. We are still going to continue all the sanitation practices that you saw during the presidential preference election. And again, if you have any questions or concerns, you can always email us at elections@voteseminole.org, or you can call our office at 407-585-8683. And now I will turn it back over to Chairman Zembower. Thank you.
Thank you all again, and I appreciate all the folks here today to talk to the business community and our Supervisor of Elections. We'll take some questions here in just a moment. Just got notification I want to share with everybody. If you have a desire for a drive-up test, we just got notification from Orange County that the convention center lines are extremely low. The capacity today is up 100 to 350 tests will be run. So if you meet the criteria, first responder, healthcare worker, or meet those requirements of the physical conditions that you may have with the shortness of breath, fever, et cetera, would urge you that if you want to take advantage of that, get down to the convention center and by all means get in line with your car. So with that, we'll open up for questions.
Alan, if you could step up to the room. Obviously, between word of mouth and social media, there's some stuff that's been flying around about hospitals, at least some of them in Seminole County, being already filled with COVID-19. I know you threw out some numbers,
Sure.
but kind of quantify, where are we as far as capacity and places where people can go?
Sure. So all of our hospitals report twice a day to a system that we have in our emergency operations center. We also work with the emergency managers of all 3 of the major hospital systems, HCA, Orlando Health, and Advent Health. And right now we have about 65% availability of hospital beds inside of the county, so quite a bit of beds. As far as the impact of COVID-19 individuals on the hospital system, so that's every patient. That's cancer, heart, whatever. The only number of, the positive cases that are currently in our hospital system is 14. in our county. So very minuscule
So that's 14 people in 3 separate hospitals.
at 4 separate hospitals. So we have Oviedo Medical, Central Florida Regional Sanford, South Seminole Hospital, and Advent Health Altamont Springs. So only 14 of those are positive. Now we have 29 with other types of with symptoms. They're there for other reasons, but they also have symptoms of COVID, so they're also being investigated for that as well. So a total, if you total both of those, of was that 43 individuals, but again, the 29 we can't count in there because they have a test or they just have the symptomology.
So presently, we have no capacity issues.
No capacity issues whatsoever at this point, but of course, in emergency management, we always plan for the worst, right? Even during a hurricane, maybe a Category 1 hurricane coming towards the state of Florida, and we're preparing for a Category 5. We're preparing for the Category 5 pandemic, but we hope that...
I heard Chairman Zembower say, you guys already have surge agreements in place with the surrounding counties, so everybody can, share and share alike?
Yeah, so the first step, of course, is going to be to surge the hospitals. So the last effort that we want to do is try to open up an alternate hospital, because the staffing, the hospital beds, the ventilators, all the equipment that would need to go into something like that to build a hospital, that's a lot of work. So if we can increase the capacities of the current hospital systems, and all 4 hospitals have amazing plans on how they're going to do that here in the county, and we've seen some of the numbers. All the numbers aren't out yet, but we've seen some of the numbers of the hospitals, and it looks very promising based on the projection. So if the projections hold true and the surge capability is achieved, we shouldn't have to open up a field hospital. But remember, in emergency management, we always plan for the worst case scenario, so we are planning for the field hospital.
And if I may, that being said, then compliance, of course, comes back, because the whole reason your projections are looking like you're going to have enough capacity is you've mandated the social distancing and trying to hold people accountable.
Sure.
We've had like really 2 phases. We had social distancing initially, and then this executive order that had to be passed because people who were in quarantine, COVID positive, went shopping.
Right.
Since those 2 orders in place, what is compliance as we're speaking today?
So our business community has been compliant. Our business community has social distancing markers on the floor like required here in the county. They've done incredible work. A lot of the businesses had done it before. Some of the businesses said, you need to enact this so that we can tell our corporate so we can actually do it. So all of those businesses are in compliance. We've had very, very few complaints over the last few days of any businesses violating the executive orders. We've found that social gatherings, less than 10 people, we found very few issues whatsoever across the county. So those executive orders are holding true. As far as individuals staying in the home, COVID positive individuals are staying in the home. We aren't seeing that they are moving about the county. Unfortunately, with those individuals that are supposed to be isolated and quarantined because they came in contact with someone with COVID-19, not so much. So we've been educating them. We've been trying to tell them you need to stay at home. The Florida Department of Health has told you to stay home. We don't want, the last thing we want to do is issue another executive order to tell those people to please stay at home. You've already been told by a doctor. You've already been told by the Florida Department of Health. You've already been tested. So please just wait till the test comes back. And unfortunately, we are still having issues with that.
Handful or?
It's a small group, about 12 today. Anyone else? All right, well, thank you all very much.